According to the American Academy of Dermatology, between 40 and 50 million Americans suffer from acne at any one time, and finding effective treatments can be frustrating, but there are some new solutions. Joining us now to talk us through the latest acne treatments is dermatologist Dr. Doris Day. Dr. Day, great to see you again. Thanks
great
for being
to be here.
So acne is not just for teenagers. This is something that afflicts everyone.
That's true. You know, one of the biggest myths is that you outgrow your acne after your teenage years. I see patients day after day who didn't even start to get acne until they were in their 20s or even 30s. So this can really be an adult problem, not just a teen problem.
And an adult freaks out, I'm sure, when it happens because they think, why is this happening to me?
It's true. When you start getting wrinkles and pimples, there's just something morally wrong about that, you know?
Absolutely. Now, what is it that causes acne exactly?
We don't know exactly what the underlying cause is, but we know what we see and we know what tends to make it better. So all underlying acne is kind of the same thing. The skin cells don't slough off as they should. We know that stress may be a factor, hormones, especially in adults, may be a factor, but that underlying inflammation, P. acnes, bacteria, and abnormal sloughing of skin cells builds up to either form a blackhead, a whitehead, a pimple, or a cyst. And you can scar more over time as well.
Absolutely, because your cells don't regenerate as easily. Is that right?
As we get older, we just don't heal as well as we used to.
Now, is a simple pimple the same thing as acne?
Yes, so there's lots of zit, pimple, acne. There's so many names for what we call it, but the underlying mechanism is really all basically the same.
Right, and when it comes to that chronic acne that keeps coming back, are there things that we can do to avoid that happening?
Well, the really important thing to understand is that if you're prone to acne, and adult women who get acne, it's usually in the lower face along the jawline, and that is more hormonal. So sometimes you need an internal fix with a hormonal balance, either through oral hormonal contraceptives or some other mechanisms, but topical treatments do matter, and it is helpful to see your dermatologist because we can help you get it under control whether or not you're using over-the-counter products.
Absolutely.
And the important thing is that you treat even areas where you don't see acne, because once you see the pimple, you're already behind. You really want to get ahead of it and prevent new ones from forming.
So you don't believe in spot treating, just going right after the pimple?
Not so much. It may help it dry up a little quicker, but what happens oftentimes is when people spot treat, they even over treat, so they end up getting more irritated from the spot treatment.
Right.
So if you can spot treat it really early, then you have a chance of getting ahead of it. But most often, you want to treat the whole area and try to prevent new ones from forming.
And we're going to talk about some new ways we can treat acne. One way that we shouldn't treat it is with alcohol. Is that right?
Right. Rubbing alcohol on your face is probably one of the worst things to do because it dries out your skin and does absolutely nothing for the pimples at all. So it has no effect on the bacteria that causes acne. And Neosporin, polysporin, also no effect on the bacteria that cause acne.
All right, so leave those things behind. Let's talk about some of the new treatments out there. Very exciting. Very exciting new development with this blue light, correct?
Right. So blue light has been used in doctors' offices for a long time to help treat acne and some other underlying medical skin conditions as well. But now there's some home devices that incorporate blue light into their process of helping treat acne besides using skincare products. So one is really brand new this month is a Tanda Zap. And this uses blue light. You can even turn it on and feel it on your skin. There's a little bit of vibration to it and some heat. So if you hold it to your hand, you can feel that vibration, which and the heat helps open up the pores, and then the blue light is very sensitive, very specifically absorbed by the bacteria that causes acne. And this is about $50 in your drugstore.
And how long would you have to keep it on the area?
It has its own timer, so it's typically a few minutes. But it's a pretty fast process, and it's so much better than picking.
Now, would you have to do it just spot by spot and move around?
Right, but this covers a pretty large area, so you can do your whole chin in probably about 5 minutes.
Fun. And how much is something like this?
This one is about $50, just under.
Not bad, not bad. Absolutely.
And you could throw it in your bag, and when you're out and about, just go in the bathroom and do that, and you feel like you're doing something for your skin, and it does help it clear more quickly.
How many
and
times
prevent
a
new
day
ones.
would you?
Once a day is
Once
plenty.
a day, okay.
Yeah.
Now this program also incorporates the blue light, is that right?
Right. This is the Tria Skin Clarifying System, and this is also relatively new out. And this uses blue light as well, but along with the skincare regimen that will help clear the acne more quickly. And both of these have pretty good clinical data that they work. So these are good adjunctive treatments while you're doing other skincare regimens from your dermatologist, or if you can't get to a doctor, a lot of people start with over-the-counter products. And these are reasonable to use along with what you're doing at home. But this comes with a whole system, so they try to make it step by step for you.
So it has the blue light plus products. And these products work as well, you think?
Yeah, these are pretty typical products that we like for acne, including things like benzoyl peroxide, salicylic acid, and they always have their own patented technology that helps them claim superiority over other products, and I love that too. That's always good.
Absolutely. And then finally, this is just a cream, correct, that you could put on your acne?
Right. This is Effaclar Duo, also available through your dermatologist or at your drugstore, and this incorporates benzoyl peroxide and a derivative, a type of salicylic acid called LHA that helps treat the acne.
You don't need a prescription.
Don't need a prescription. Okay. So it's a good place to start. And these are also safe in skin of color. So you always have to be careful if you're irritated or sensitive to products, but these have also been tested and are safe for skin of color.
And can you use that cream all over your face or just on the affected area?
You can use it either way, but you can use it as a spot treatment as well, but ideally, again, you'll get it early.
And it works by sort of burning off a layer of the bad skin, so to speak?
The benzoyl peroxide is antiseptic, so it does help knock out the bacteria that's causing acne, and it's also anti-inflammatory. And the LHA, the derivative of sal acid, is also helping to exfoliate, which helps the skin cells clear more quickly.
Fascinating. All right, Dr. Doris Day, thank you for explaining all these new products available to us in the home. Yes. And of course, don't forget to check with your doctor, and maybe an in-office visit might be the answer for you as well, because I'm sure you take it to another level in your office, correct?
Absolutely, but we work adjunctively with home care products.
All right, thank you so much, Dr. Day. And don't forget, you can follow ABC News Now on Facebook and Twitter. Just search ABC News Now.